Today's town hall by digging into a debate that's really heated up over the past week or so. What time should your child start school? Specifically, high schools, where classes, of course, begin earlier in the morning. The American Academy of Pediatrics recommends high schools start at 8:30 or later. That's already the law in the state of California. And our neighbor, New Jersey, could soon become the second state to require schools start at 8:30 or later. And it turns out there are bills pending in our state Senate and Assembly that would do the same right here in New York. Both are in their respective education committees, but they've never advanced to actual votes. If such a rule became the law here, though, it would have a big impact. Two on Your Side picked a bunch of random high schools in our region and looked up the start times. As you can see, every single one begins class before 8:30 in the morning. West Seneca High School starts at 7:30, both of the high schools. That's among the earliest around. The latest start time that we found was South Park in the Buffalo School District. The bell rings there first at 8:20 in the morning. Joining us live right now to talk about this is Dr. Donald Pickhardt III, Chair of Pediatrics for Catholic Health. It is great to have you on. You know, there is the political side of this debate. We mentioned, this potential law, but in terms of the health impact, do you agree with the American Academy of Pediatrics that starting school before 8:30 in the morning could be bad for kids' health when you're talking about that kind of teenager age group?
Yeah, actually I do. I think the science is pretty clear. It's been out for quite some time. Teenagers tend to sleep in, and our our response as adults is, oh gosh, why is this kid so lazy? But they are biologically programmed to fall asleep at a later time. In adolescence, our pineal gland makes a hormone called melatonin at a later time. So they're really incapable of falling asleep earlier than, say, 10 or 11 o'clock. And that's different from younger children or even adults after age of 25. So for adolescents, they're really, not getting enough sleep if they're going to bed at that time and can't fall asleep until after that. And then we're asking them to get up at 6 or something in the morning. The AAP, or American Academy of Pediatrics, and CDC recommend that adolescents get at least 8.5 or 9 hours of sleep. When they don't, their academic performance suffers. They suffer with regard to their athletic performance. They have increased risk-taking behaviors, increased impulsivity, increased emotional ability, decreased attention span. And in the long term, it can affect their health as well. It's linked to a higher incidence of obesity, heart disease, growth suppression, anxiety, and depression. So I strongly advocate that adolescents start their day earlier. Any teacher will tell you they spend the first couple periods of their morning essentially sleepwalking. So yeah. I think this is the right move for them.
I want to share a couple of quotes real fast. So we reached out today to State Senator Sean Ryan and Assemblyman Bill Conrad because they're the two local lawmakers on the education committees where these bills are pending. Again, this bill that would require 8:30 or later start time. So Senator Ryan said that the bill tackles an important issue, but he said it's difficult for parents. He says this is one of those times where we need to weigh the interests of the family unit as a whole. This is a decision best left to local communities and one that should be based on conversations between families and school boards. And then Assemblyman Conrad added, quote, certainly research has shown that later school start times for kids, especially high school students, are beneficial. However, we're currently facing bus driver shortages and the logistics around busing often dictate start times. The Assembly Education Committee has not yet reviewed the related bill. So, Doctor, I've got about 30 seconds left. As this plays out, in the absence of a law that requires the later start time, what would be your advice to school districts to try to address this lack of sleeping among kids?
Get creative. I think that there are ways to overcome these logistical issues. Many school districts have. Families adjust. Most adolescents don't necessarily require an adolescent to get them out the door if they're getting out the door at a reasonable time for them. So I think that there are things that can be done to make this happen. Maybe in lieu of gym class, as far as student athletics goes, or any number of things that can be done that will help school districts do what is in the best interest of the child instead of what's in the best interest of the school district.
Dr. Donald Pickhardt III is Chair of Pediatrics for Catholic Health. I know it's a busy time. You opened pediatric ER rooms down there at South Buffalo Mercy, so appreciate you taking some time and talking about this important topic. Good to see you.
My pleasure. Thank you very much.